Today we're going to prepare for Muscle Lab B. Muscle Lab B is about the superior part of the body. We're going to talk about the finger joints, the wrist joint, the elbow joint, and the shoulder joint. And we're going to talk about some movements that are possible at each. And the movements we're going to be talking about are flexion, extension, ulnar deviation, and radial deviation. First, let's talk about the idea of flexion and extension. Standing in the anatomical position, it's easiest to see flexion and extension as both forward and backwards movements at the joint. Looking at my finger joints, when I curl them or fold the joint, this is what is called flexion of the finger joint. Straightening the joint is called extension. Flexion is folding, extension is straightening. Notice it is happening in the forward and backward direction. Wrist flexion is folding the wrist, and wrist extension is straightening the wrist. Wrist flexion, wrist extension. Flexion of the elbow is folding the elbow. Extension of the elbow is straightening the elbow. Elbow flexion, elbow extension. At the shoulder joint, flexion of the shoulder is bringing the arm up and forward. And then extension is bringing the arm back down toward the anatomical position. Notice in the anatomical position, all joints are extended or straight. Finger flexion, wrist flexion, elbow flexion, shoulder flexion. Shoulder extension, elbow extension, wrist extension, finger extension. Finger flexion, wrist flexion, elbow flexion, shoulder flexion. Shoulder extension, elbow extension, wrist extension, finger joint extension. Some joints can also go past the anatomical position. For instance, the wrist can do hyperextension. The shoulder, the elbow cannot do hyperextension. The shoulder can. Hyperextension, movement past the anatomical position. Shoulder flexion, shoulder extension, shoulder hyperextension. Wrist flexion, wrist extension, wrist hyperextension. In addition, in this lab, we have some other movements of the wrist joint. We've been talking about forward and backward motion at the wrist joint. Now we're going to talk about side-to-side motion. From the anatomical position, move your wrists directly sideways. Notice that there is movement towards the thumb side and towards the pinky side. Towards the thumb side, toward the pinky side. Recall that the radius is above the thumb. This is why this is called radial deviation. Deviation of the wrist toward the radius. We also have a bone on this side above the pinky called the ulna. That is why movement in this direction is called ulnar deviation. Radial deviation, ulnar deviation of the wrist. Wrist flexion, wrist extension, wrist hyperextension. Radial deviation of the wrist, ulnar deviation of the wrist.